Thanks, Mr. Chairman. Welcome, Madam Secretary. I'd like to discuss the so-called companionship exemption under the Fair Labor Standards Act and the proposed rule of the Department that I believe the comment period may end tonight. So I'd like to make a comment about it, and then I'd like to ask you 3 questions, all of which I believe you could answer yes or no without offending anything in the Administrative Procedures Act. Here's my comment. I understand it hasn't, my worry is about changing the way overtime is considered with the companionship exemption. Here we're talking about a situation when mostly seniors would hire someone or some small business to provide a nurse or a helper to live in with that person or to come to that house every day to help someone. And the proposals that the proposed rule would seem to have concerning overtime suggest to me that the rule would mean that seniors in America would have less care because it would be more expensive. There would be fewer jobs for those who are helping, and it would likely force a large number of people who are now cared for in homes into more expensive institutional settings, which would drive up health care costs in states which are already struggling with health care costs and are about to be hit with the new costs that come with the Medicaid mandates on the health care law. So I'm concerned that the Department hasn't sufficiently evaluated the impact of the rule on what it will do to seniors who need care, on people who want jobs, and on Medicaid costs in states. The Office of Advocacy at the Small Business Administration recently sent a letter to you stating the Department's economic analysis doesn't fully reflect the fact that the majority of the in-home companionship services are provided by small businesses and are paid for through the private market. These small businesses will have to pass on the higher costs of this new overtime to seniors, most of whom are single and living on fixed income. So here are my three questions. 1, will the Department follow the SBA's recommendation to conduct a more thorough economic analysis before moving forward with this proposed rule? That's number 1. Number 2, my office was told by your staff that the Department didn't consult with a single Medicaid director when developing the rule. Is that true? I'm especially interested in that because Medicaid's 24% of state budgets. And number 3, is the Department willing to withdraw the rule to conduct a more comprehensive analysis of the impact on state Medicaid programs and budgets?
Well, Senator, I would first of all tell you that in looking at the companionship exemption through FLSA that was established back in 1974, it was intended at that time to really look at other kinds of occupations like babysitting. Didn't really encompass this whole new arena of healthcare, in-home healthcare providers. And so it has changed because of changing
Well, but the change is that we have a lot more older people in America who don't have money, who are often single, they need help, and they can't afford a big overtime bill.
Senator, I don't disagree, but I also know that there is more professionalism that's come about in this industry. And you have different providers who would like to keep people not achieving, say, a better footing in terms of the economy through these jobs, and so they do not want to pay them. Many of them have, I know, have already commented that they are very concerned about the overtime pay. But we're looking at an industry of about 2 million women, mostly women, in this area that are already trying to make ends meet and are paid very, very
well. If you
low.
put them out of work with higher costs caused by your overtime rule, they'll really have a hard time making ends meet.
Well, I think one of the things that we're attempting to do here is also level the playing field, because you do have some good providers, some good folks that are playing by the rules and allowing for that.
There's no rule that requires overtime pay.
Well, what we're looking at here again, sir.
So what you're doing is talking about raising the cost of home health care to people who can't really afford it and putting people out of work who can't get the job. That's what you're really talking about.
Well, we're still taking comments, and I know that we have, because of the enormous amount of
Well,
comments.
what about the answer to my 3 questions? Will you get an SBA report before you move ahead? Did you consult with any Medicaid director in any state? And if you didn't, will you before you do the rule?
Well, certainly, we have a responsibility to always look at economic impact.
Well, the answer can be yes or no, ma'am. Did you or will you follow the SBA's recommendation? Yes or no?
I will get back to you on that.
That's not a yes or a no. Did you consult with any Medicaid director in any state about the increased health care costs?
We have consulted with a broad variety of
Did you consult with
different
any
groups.
Medicaid director, which is 24% of the costs of a state budget, about the impact on their health care costs?
My staff met with several stakeholder groups, yes.
Did you meet with any Medicaid director?
I did not directly.
Did your staff? They told me they didn't.
I have to ask my
So you don't know?
wage and hour deputy.
You don't know whether you met with
Not offhand, but I know that I have been informed fully that they have met with various stakeholder groups.
Well, I didn't ask that. I asked whether you met with a Medicaid director about this.
not
And if
personally,
you didn't, well, whether you
No,
did or
I
not,
did
are
not.
you willing to consult with Medicaid directors about the effect of the proposed rule?
Certainly.
Thank you.
Certainly.
Thank you, Mr. Chairman. Thank you, Madam Secretary. I want to talk about the